Good afternoon. I am delighted to be here. I'm Seth Cohen. I'm the president of Cedar, and we are here to talk about how we work together to automate the prior authorization process. And so, Robin.
All right. Thank you very much. My name is Robin Free. I'm a registered nurse and an AVP at Palmetto GBA. Palmetto GBA is a Medicare administrative contractor. We administer the Medicare contract in several of the southeastern states. And about 2 years ago, CMS said, we're going to start a prior authorization program for hospital outpatient department services. As you can imagine, providers were really excited about that. So when that announcement was made, Seth came to us and said, hey, we have a solution for you to help reduce the provider burden on submitting prior authorization requests. So instead of submitting the request to us with the medical records, our nurses go in and we get the prior authorization request from the provider, but then we go into Optic to view the records. Next slide. And there's several benefits to this process, to this change. The first one is to the provider. They no longer have to go out to their medical record system, their EHR, pull down the medical records, save them to a file, and either submit them to us electronically, or even there's a lot of people that still love to fax. They'll print them off, fax them, or print and mail even. And so it reduces that process for them, and also reduces errors. They probably don't even realize how many get non-affirmed or non-approved because of errors. We get the wrong patient because they pulled the wrong one down, or more often we'll get the wrong date of service or the wrong records for that patient, and we have to non-affirm them for that reason. Now, on our side, our review nurses, the benefits that we have to our program using Optic is that when our nurses go into Optic to view the medical records, is a very consistent review. So it makes the process very efficient. The nurses know exactly where to go to look for that information, and it's always in the same place regardless of what healthcare system that they're looking at. So it helps us and make that review more efficient. Seth?
On the health system piece, just to make sure we have the context clear, as Robin said, this is a new mandate from Medicare, so they had to stand up a whole set of processes on their side to make sure to review this clinical information in an efficient way. And so at Cedar, one of these solutions that we brought to the table, Optic, as Robin mentioned, was to assist Robin's team with reviewing that information in an efficient way. I kind of like to compare it to like a DocuSign experience. You know, who here has used DocuSign before? I think probably most. And you know how it kind of guides you to directly where you need to look instead of having to read this huge document? It's a little bit like that experience for Robin's team. But on the health system side, it's a really important lever for cost savings because, as actually very similar to the presentation just before, a lot of this work between provider and payer is very manual, right? The providers need to spend a lot of time submitting this documentation, often through fax, sometimes through a portal, and you're kind of uploading a lot of this information, and that takes a lot of nurse time, a lot of staff time, sometimes physician time. And so we had created connections to the electronic medical record of participating providers to capture that information automatically and passively. And so that saved the team at the health systems time, especially when there's a staffing crunch around, so they didn't have to spend all that time doing that administrative work and that uploading. So in terms of some lessons learned, there's way more than we have time for to share on this page, but I think what was really critical was to engage the right folks within both the payer and provider teams. We were very grateful to find Robin and her team because, again, this was a new mandate, so there were a lot of folks involved on the payer side. You had to have security, information officers, of course, clinicians who are the stakeholders here. And similar on the provider side, we'd come to a provider organization and we'd say we have this great idea, and you'd get a CISO involved and a CIO, and you'd have to make sure that this integrates well with their EMR systems. And then, of course, you have to have the teams responsible for the work. And so these are multi-stakeholder teams, and you have to talk to each of them and make sure that each of them really understands what this is all about, and is it safe and secure, and meeting the needs of each part of the organization. This note on being flexible, I think, was also really important. Candidly, at Cedar, we have two solutions. One is on the patient financial space, which is very mature, and we have rolled that out very broadly. This was a relatively new solution, our Optic solution, and Robin and team were really great partners with us in figuring out how to make this work, and that involved a lot of iteration on our side. So one thing we learned, for example, is we thought initially we'll just take that DocuSign experience and just pull out what we thought were the relevant pieces, and we would just show those relevant pieces to Robin's team, and we'd be done, and isn't that great? Well, it turns out that nurses and folks working in these payer environments actually take a lot of pride in being very exhaustive in reviewing this. These are people's medical cases. These are important cases. And so it was really important to the nursing staff to have the full document on hand to review. So they liked that we were pulling out key elements, but they really wanted to make sure that source document was available as well. That was a really big learning from our team, and it only happened by really sitting down and doing those chair sides and that workflow following. So that was really important. Oh, whoops, go back to the page. So I think to wrap up, the one thing we're really excited about is to expand the work that we're doing. We've started in a particular service market, and so we're excited to grow together in other service markets and work with other providers because this Medicare mandate is not just in South Carolina. So, great.
I think we have a couple minutes for questions, if there's any questions out there.
Yeah, great question. There's no enrollment because they're not, they as in the provider is not signing up for the program or choosing to use this as their prior auth. It's not a clinical decision support tool for the provider. It is simply a means to connect your EHR to a key payer. It's very similar to, again, that prior presentation around the Epic Payer Platform connecting to a payer partner. You're just allowing an EHR connection. You're allowing the APIs that your EHR publishes to go to a preferred partner.
So our nurses have a window into the providers or the provider's medical records, and it's very limited to a specific criteria. So we have 7 different services that we require prior auth for, and it's only set up for those services. So we can't go in and see everything in their medical record.
Yeah, we get that a lot. You know, no provider wants a vacuum cleaner of sorts, taking every spec or field out there. So we had to be very, very intentional about what is needed and provide transparency into what data was used and for what use case. Yeah, Cerner and Epic are the primary ones we're working with today. Outside of Epic, well, we work with whichever providers are out there that are part of the network of Palmetto and other payer partners. We will work with those providers. So it's really just a function of which EMR platforms those providers use, and we'll support those. Yeah, thank you.
No, we only store the medical records that we view, and we keep those for audit purposes.
Okay. Yeah, thank you.